it's Kara again. In this video, we're going to be talking about how eating disorders affect the mind and body. Eating disorders have a devastating impact on the mind, body, and spirit. And the effects of an eating disorder cause a vicious cycle of pain, physical deterioration, and worse symptoms. Here are some of the health consequences that occur as the result of an eating disorder. When the body needs energy that it's not getting from food, it will take it from other parts of the body by breaking down muscle, which includes the heart. As the heart becomes affected, one's pulse slows down and their blood pressure begins to drop. This is one reason why someone with an eating disorder may become lightheaded when they stand up. Their risk of heart failure also rises as their heart rate and blood pressure levels sink lower and lower. Purging by vomiting or laxatives depletes the body of important chemicals called electrolytes, and an imbalance of these can cause irregular heartbeats or even heart failure. There can be a big impact on the digestive system as well. Food restriction causes a depletion of important vitamins and minerals that the body needs to function properly. Having stomach pain and bloating or feeling full after eating only small amounts of food is common. Because digestion slows down, there may be constipation and/or blocked intestines. Bacterial infections can take hold because of a poor immune system. Binge eating can cause the stomach to rupture and create a life-threatening emergency. Vomiting can wear the esophagus down and cause it to rupture, which is also life-threatening. Both malnutrition and purging can cause pancreatitis, symptoms of which include severe pain, nausea, and vomiting. The brain is also impacted by eating disorders. Although the brain only weighs 3 pounds, it consumes up to 1/5 of the body's calories and relies primarily on carbohydrates. Dieting, fasting, self-starvation, or erratic eating behaviors mean that the brain isn't getting the energy it needs. This can lead to increased obsession about food and body image and cause difficulties concentrating. Extreme hunger or fullness at bedtime can make it difficult to fall asleep or stay asleep, and lack of sleep then takes an even greater toll on how the brain works. Inadequate consumption of dietary fats can damage the protective layer that surrounds neurons, causing numbness and tingling in hands and feet or other extremities. In other words, parts of your body will feel like they're falling asleep. Severe dehydration and electrolyte imbalances can lead to seizures. If blood vessels can't pump enough blood into the brain, it can cause fainting or dizziness. The brain can actually shrink, which affects concentration, memory, thinking, and fear responses. It can lead to brain fog and make you suffer from rigid rules and fears rather than having the ability to be spontaneous, creative, and flexible. Hormones are very important, especially in the teen years, and are greatly thrown off balance as a physical repercussion of eating disorders. The body makes many essential hormones from the fats and cholesterol we eat. Without enough fats and calories in our diet, levels of hormones can fall, including sex hormones like estrogen, progesterone, and testosterone. These don't get made adequately and can cause a female's period to become delayed, stop, or not start at all. Lowered sex hormones can significantly increase bone deterioration, leading to osteoporosis, which will increase one's risk of breaking or fracturing bones and experiencing tooth decay or even tooth loss. Eating disorders also lead to a reduced resting metabolic rate as a result of the body's attempts to conserve energy. Without enough energy to fuel itself, core body temperature will drop and it will become difficult to keep warm. Eating disorders are clearly harmful and are actually the most fatal of all mental illnesses. Eating disorders are usually unconsciously used as an unhealthy way to cope with one's problems. And if you have an eating disorder, know that you are not alone. It's estimated that over 30 million people in the United States are struggling with an eating disorder. And if you or anyone you know has an eating disorder, please reach out. Speak to a counselor, a parent, a healthy friend. Anyone you know is going to support you and help you find a path to recovery. You don't need to let your eating disorder control your life. And if you're in crisis right now, please call the hotline below. If you're interested, check out our next video on the types of eating disorders.